Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to be with you today. In today's episode, the topic is embryology. Students taking embryology are usually also learning about histology and some other head and neck anatomy. And I have to tell you, when I took histology and embryology, I was like, why am I learning about this? This is nonsensical. I'm working with patients who are, 1 year old to infinity. Why would I ever need to understand embryology or learn all the complications and considerations from the zygote all the way to the developing child? Why would I need to know all of that from the one little egg and sperm cell all the way to birth? They don't even have teeth, right? So one of the things that I hope you discover through the process of listening to this episode is the reason why you have to learn it. Because I think if you understand the why behind learning about embryology, it will change you into having a mind of curiosity and really develop the knowledge that you need in order to face any challenge that comes your way with a patient that sits in your chair. So let's start right off with some of the terms. So what is growth? Growth is increasing the number of the cells as well as the size and dimension of the cells. And then development. So you have growth and development. Development is the process of maturity, maturing those cells. A couple of other terms that are important for you to know. Interstitial is increasing the size by adding layers deep within the tissue. So so within. And then appositional is increasing the size by adding layers outside of the structure. We also have differential growth, and not all parts of the embryo grow at the same rate. So that would be the definition of differential growth. You might have a large amount of growth in one area, while the other area remains very subtle. And then that area might tick up and start increasing its amount of growth. Now, there are 5 processes involved in growth and development when it comes to the human body. The first one is induction. And that's the first step in development. The cells establish pathways for themselves. Proliferation is the next step or next process. And that's controlled cellular growth that occurs over a long period of time. Differentiation is the next process, and that's when all of the cells start to change into their specific structure or develop their unique functions. Those specialized functions are really important for the tissues and the organs. And then the last piece, the last process is maturation. That's the final stage, right? Everything has reached its final function. So starting off as an egg, and then fertilization occurs, and then now you have division into 2 cells, and then 4 cells, and then 8 cells, and then 16 cells, and then you become a blastocyst. And that blastocyst travels down the tube and drops into the uterus. And so when the implantation occurs, that blastocyst comes down into the uterus and it finds its way into the endometrium. And after 1 week, that blastocyst has a nutrition layer for the embryo called a trophoblast. The placenta and the umbilical cord, that circulation starts to develop, and the blastocyst will then start to take on a disc shape and then kind of fold and curl into this like cephalic head and a caudal tail. This will contain the primitive head and the 3 layers, the ectoderm, the mesoderm, and the endoderm. The ectoderm is ecto. Ecto means outside or exterior. And as a hygienist, it's good for you to know that that forms the enamel organ. The tooth, it gives rise to the interior, so all of the exterior. So think about the covering or the lining outside things, the nervous system, the skin. It also makes the glandular tissue, which is kind of an extraordinary little piece for the ectoderm. The mesoderm is the middle component, and meso meaning middle. It forms things like the dental papilla, the pulp, the dent, all the dentin, the inside piece. The mesoderm that surrounds the enamel organ, the sac, it forms the cementum and the periodontal membrane. The immature connective tissue is called the mesenchyme. That's another really good word for you to know. So the mesoderm, it creates the dermis, all the connective tissue, all the tooth except the enamel is formed by the mesoderm. It also does all the other middle things like the skeletal system, the muscles, the kidneys, the lymph cells, the reproductive organs, and the heart, everything that's in the middle of the body. And then you have the endoderm, which is inside. And that forms the epithelial lining, endo meaning lining, inside, the epithelial lining of the respiratory passages and the intestinal tract, the innermost structures like the stomach, the bladder, the lungs, the liver, the gallbladder, the pancreas. So that disc, that trilaminar disc, begins to develop that head and that tail, as I said. And at the end of the embryonic period, most of the body systems and the organs have developed. So here's a key thing for you to know. Most dental anomalies and congenital defects occur during the embryonic phase. And sometimes you can understand a test question if you know the terminology, even if you don't know exactly what the question is asking for on a test, or more important, the board exams, you might be able to make a determination of what the correct answer is based on knowing the terminology. All right, so think about each one of those layers, and they will create to form specific tissues during that development. So when you're looking at the embryonic phase, the face is divided into 4 structures. You have the stomadeum, which is the primitive mouth lined by ectoderm. You have the frontonasal process, and that makes the forehead, the nose, the philtrum, and the premaxilla and incisors. And then you have the maxillary process, and that's on both sides of the stomadeum, and it's formed by pinching off. And then the mandibular process. Now, the globular process is in there as well, and that's an extension of the nasomedial process. I think the best thing for you to do is do a drawing, and it could just be circles and sticks and squares. Don't get all detailed with your drawing, but it's really good for you to say, okay, where is that globular process and what does it do? It's located below or above this. It's located to the left of this or right of this. Definitely take the time to understand the location of all these little blobs, right? So that bilaminar disc, it gets kind of tubular, and then it forms this little blob of, it almost looks like a little 12 millimeter long blob of tissue with all these little rolls and folds. And all those little rolls and folds are important for you to know. So basically, the entire face is made up of the frontonasal process and the first brachial pharyngeal arch. So important information for you to then decipher, really get into the details. Where is the location of this? Where's the location of that? Is this above or below the stomadeum? So those are the types of things that you want to be learning about so that you have a really good handle on the development of face, the development of the face, and kind of where those anatomy pieces come from. So the brachial arch and bilateral swellings, also known as the pharyngeal arches, those are below the stomadeum. And the first brachial arch, also known as the mandibular arch, it makes all of the teeth except for the 4 front teeth. And that is from the frontonasal process. So between the frontonasal process and that first brachial arch, you're really creating almost the entire face from those 2 parts. The frontonasal process is the largest of all of the processes. And then the maxillary process makes up the middle part of the face. The mandibular process makes up the lower part of the face. And all of this is happening between week 3 and week 12. Now, I talked about the first brachial arch. The second brachial arch, also known as the hyoid arch, that complete arch extends from one side to the other, and that contains the Reichart cartilage. That gives rise to the muscles of facial expression, part of the hyoid bone, the middle ear, and cranial nerve number 7, the facial nerve. So doesn't that make sense? I want you to think about connecting some of the dots here. So if the second brachial arch gives rise to the muscles of facial expression, it would make sense that it would also give rise to cranial nerve 7, which is the facial nerve. So the facial nerve and all of the muscles of facial expression kind of go together, if that makes sense. The third through the sixth brachial arches, which are located below the hyoid, these are really incomplete arches. That first brachial arch is the most significant of the arches. And these kind of disappear as the embryo grows and develops. But the third brachial arch gives rise to the body of the hyoid bone and the glossopharyngeal nerve, and those are two important things for you to know. The fourth through the sixth arch, those give rise to the larynx region and the palatal muscles, as well as the vagus nerve. So there's also pharyngeal clefts and pouches, and those little grooves and clefts are located externally between the brachiopharyngeal arches. The pouches are located internally between the brachiopharyngeal arches. Now, you want to look into, and maybe a drawing would help you with this, what the different clefts and pouches develop into. The first cleft develops into the external auditory meatus, and the second through the fourth cleft disappear due to the growth of the second arch. Now, when you're looking at the clefts and pouches, now that second through fourth cleft, they normally disappear, but sometimes a cervical cyst can form if those clefts do not disappear. So when you're looking at this stuff, what I want you to do is try to connect or associate something that could go wrong as you're learning what the developmental process is. So that will help you better understand the why behind when things go wrong. So if you know, for example, how the palate forms and comes together, and that the plates come down and then the seam forms, and that the frontonasal process is part of the primitive palate that contains the 4 anterior teeth, and that all of that buttons up and comes together, and that the 2 seams come together, it will help you understand how cleft lip and palate are created. So you can have a cleft lip, or you can have a cleft palate. Can you have both? And how far during the process of that closure will something happen that would form one or both of those things? So learning about the timing of things and the process of things, and then figuring out what developmental disturbances can happen as you learn about those, might help you connect the dots and remember the embryonic development piece. I hope that's helpful for you and didn't actually be more confusing. So we're looking at week 4. The neural tissue, which is formed by the ectoderm, migrates into that upper part of the embryo and develops a neural tube, which is the future spinal cord. That migration provides the embryonic tissue the formation, or what will be the formation, of those 12 cranial nerves. There's a lot going on all at the same time. So other things that are going on in week 4, the lens placodes, which are developing, become the future eyes, the otic placodes become the future ears, and the nasal placodes become the future nasal openings. Like I said, the embryo is about 12 millimeters long at this point. The other piece of information that's important for you to know during embryonic development is fusion and how the fusion occurs. True fusion, which is what occurs on the maxillary arch, is when you have the union of structures which are entirely separate from one another. So first, the structure must come into direct contact with one another. And then secondly, the epithelial covering of the 2 surfaces must fuse with each other. And this is exactly what happens on the palate. Now, apparent fusion, which is the elimination of a groove between 2 swellings of tissue that are on the same structure, and it fills in with mesenchyme cell growth. This is not completely 2 structures that are located on the same surface. Most of our facial structures come together by apparent fusion. Now, the reason why embryology is so important for you as a clinician is because of some of the malformations and disturbances that can occur. Some of these you have to know for your board exams, and some of these are really important for you to know or at least understand in case you come across this in the clinical setting. So most of these disturbances occur during that first trimester, so week 1 through 8. And oftentimes the mom is not even aware that she might be pregnant and carrying a child. A brachial cleft cyst, which is a cervical cyst, it occurs when the 2nd to 4th brachial clefts do not disappear. And it will leave an open sinus in the neck. It's painless, but it may result in slow growth enlargement in the neck. A Rathke cleft cyst, which is also benign epithelium lined cyst, it originates from remnants of the Rathke's pouch. Now, the Rathke's pouch is a pouch of ectoderm that grows out from the upper surface of that embryonic stomadeum, and it gives rise to the area of the pituitary gland, also known as the Rathke's pocket. Now, compression near this structure leads to things like headaches, vision problems, pituitary hormone defects, and this occurs in the first few weeks of development, like I said. So these malformations due to these disturbances, you have to know. The thyroglossal duct is in embryonic development where the thyroid cells move down to the thyroglossal duct, and the thyroid gland is located in front of the neck. There's a cyst there that can develop and be present at birth. It's typically not noticed, though, because think about a newborn baby's neck. They almost have no neck. It's very hard to determine if this is a defect at birth. It's usually not identified until the child is 2 to 3 years old, and maybe they end up with an ear infection or a cold, and they go to the doctors, and now we can get visual inspection of their neck, and we can see it. Another common defect is fetal alcohol syndrome. Like I said, a lot of these expecting mothers don't necessarily know that they're pregnant in that first trimester. And really, alcohol crosses into the embryo, and it can alter the facial features where the child has a low nasal bridge with widespread eyes, a very thin upper lip, and sometimes an anterior open bite. And this is from digestion of alcohol during that embryonic development. Spina bifida occurs when there's a defect in the neural tube, also associated with cleft lip and palate. So these kind of go together. And that makes sense because that neural tube happens at the very same time as that palatal development. So those things are strongly connected. Ectodermal dysplasia is an abnormal development of the ectodermal layer. And remember, the ectodermal layer will impact the teeth, the skin, the nails, the eyes. Sometimes these patients are missing some, if not all, of their teeth. This is a sad situation when you run into any of these particular syndromes that can occur. Down syndrome, where there's an extra chromosome number 21, these patients exhibit some congenital malformations, the weak tongue and lip muscles, some deformations or malformations of their dentition. And then so the final thing that I'd just like to talk about is, I just thought this was such crazy timing, to be honest with you, because I knew I was going to record this podcast for you guys. I had a patient come into my chair and I asked if permission to just share the highlight reel of this. And she actually also told me I could use her Panorex to share with students, which I thought was just fantastic. I had a patient come in, and when I was doing her assessment, took a Panorex, and I could see that there was deformity in the mandibular arch. I could also see that she had already had surgery done on her jaw. She did have some missing teeth. There was also changes you could note on the condyle of the mandible, and it did look like she had some discrepancies in her eye socket and sinuses. So I was really interested to see what everything looked clinically on this patient. She was wearing a headpiece, almost looked like a headband with a big black box on one side. And so as I was going through her medical history with her, she revealed that she had golden hair syndrome. Golden hair syndrome is a rare congenital disorder that affects the development of the face, ears, eyes, and spine. The exact cause is unknown, but it's believed to be related to the disruption in early embryonic development. The symptoms can vary widely in severity and may be from, I just want to talk about this because this is exactly how this patient presented. Facial asymmetry. One side of the face may be underdeveloped. In this case, the patient, you could definitely see on the Panorex that one side of her face was underdeveloped. She did have deformity to that one ear and the side of her nose, as well as the side of her eye. So the shape was a little bit different. She did have ear defects. So she had underdeveloped ears on both sides, so bilateral, and she was wearing that headpiece, I found out through the medical history, so that she could hear. She told me that the ears had not fully formed and developed, so she needed that headband with that piece so she could communicate, so she could hear. And then her other main issue was that her mandibular arch did not fuse, so that apparent fusion did not occur. So she had to have surgery. And I have to tell you, it was remarkable to connect the dots between embryology and what students and hygienists have to know about embryology, and then how this patient presented in the chair. Because I was able to figure out the questions to ask her about her hearing, and ask her about the other developmental issues and connect the dots to say, oh yeah, that's why, because that happens between week 3 and week 10. And really get to the bottom of looking at the Panorex and seeing what was going on with the patient clinically and trace it all the way back to her diagnosis and say, oh, that makes perfect sense as to what's going on. It was quite remarkable, to be honest with you. And I have to say, it was really one of the few times, because some of these diseases, obviously, we don't talk about all of them because there's so many to learn about. Some of these conditions, you might never see in the clinical setting. But then there's that one moment where a patient comes in, and because you understand embryology and all of the things that happen in the different weeks of development, you're able to really put all the pieces together to make sense and maybe understand some of the other things that might be going on for that patient. Oftentimes we see patients that are congenitally missing a lateral incisor. And we know that those are highly probable to be missing because that primitive palate forms from the frontonasal process, and it's not actually part of the whole rest of the dentition. So there's lots of things that could go on. We can have the mesiodens or supernumerary or congenitally missing laterals. So when we connect the dots on the defect, it makes us understand how the development impacts that. So I thought this was a really neat thing because I was able to see the connection between the ear development, the eye development, and the development of the mandible and how it impacted this patient. She's fully functional. It was really remarkable to see all of the innovative strategies that different dental providers have given this patient in order to allow her to be just unique and beautiful. She really was. Walking down the path and seeing her out in the if you saw her in Market Basket or shopping somewhere, you wouldn't necessarily know that this is a person who was born with this defect because she's had wonderful reconstruction done and she has all of her capabilities, which is really phenomenal. The more we know about embryonic development and the more we understand about all the different parts and how they're interconnected, the better we are prepared to help patients when they show up in our chair. So I hope this episode was helpful for you guys. I know that when you're doing embryology, it's stuff that you really can't touch or see or feel. So it makes it a little more complicated to really dive into. But if you can understand the why behind it, why is this important for me to know as a clinician? I do think it makes it a little more real for you. And you just never know. Maybe and I've had this happen too. You have a pregnant woman who sits in the chair and tells you that they did an ultrasound and they found out that their baby has this or that or this or that. You can help educate your patient on how that impacts the mouth, all the things that we have to support the needs of that patient when that baby arrives. So don't underestimate the value in developing a good understanding about embryology for yourself. All right, I hope you guys are having a fantastic week and that your semester is going really, really well. Please share my podcast with your friends. That's my one ask of you. We want to make sure that all students have the support that they need to make it successfully through the dental hygiene program. All right, have a great week. I'll talk to you next week.